The purpose of this video is to promote the patient pathway for an outpatient transthoracic echocardiogram investigation at the Royal Wolverhampton NHS Trust. You'll be called from the waiting area through to the echocardiography lab. Keeping your hands clean is an effective way of preventing the spread of infections, so we ask that you, and everyone accompanying you, use the hand cleaning gel available at the entrance of the lab. In accordance with the General Medical Council and the British Society of Echocardiography, a patient will always be given the option to have a chaperone present. The chaperone must be a health professional with knowledge of the standard practice of echocardiography. You may also request a relative or carer to be present. During contact with you, the operator will introduce themselves with their name and job role. It is essential that you are correctly identified. You will be asked to confirm your identity by name, date of birth and address. This information is checked against your referral details and, if correct, is typed into the computer on the ultrasound machine. A brief description of the test will be offered and verbal consent to continue will be obtained. You'll be asked to undress to the waist and offered a gown to wear so that you are appropriately covered up. Operators will make every effort to respect your cultural sensitivities and try to minimise embarrassment. Some patients will feel uncomfortable being touched on their upper torso, and operators will be sensitive to this and act in a sympathetic, caring and compassionate manner. You will need to lie on the couch on your left-hand side. It is important to position you correctly, and a semi-recumbent position of approximately 45 degrees to the horizontal with you lying on the left side is recommended for optimal image recordings. A few images at the end of the procedure will be taken with you lying flat on your back in a semi-recumbent position. 3 sticky electrodes are placed in the mid-clavicle area of the right or left shoulder and right hip or left hip to produce a single lead of a modified ECG. A single lead of ECG recording showing your heart rate and rhythm is necessary to allow measurements to be made on the images by timing with the cardiac events. Skin preparation before placement of the electrodes may very occasionally be required to produce an artifact-free single lead of modified ECG during the ultrasound procedure. Skin preparation before placement of the electrodes may very occasionally be required to produce an artifact-free single lead of modified ECG during the ultrasound procedure. Care must be taken with patients who have sensitive or broken skin. Various methods are available to minimise skin to electrode impedance, for example cleaning with mild soap and water or cleaning with alcohol wipes. The lights in the room will be dimmed to make it easier for the operator to see and measure from the images of your heart. An ultrasound probe covered by a small amount of gel is placed gently on the centre of your chest and will be moved to different positions throughout the test, including beneath the left breast, beneath the rib cage and to the base of your neck. This enables us to see images of your heart from a number of different angles, which are then recorded as moving images and still images. Light probe pressure on the chest may cause some mild discomfort. During the echocardiogram, you will hear sounds coming from the machine or see colours displayed on the screen. This is Doppler echocardiography. Doppler echocardiography bounces sound waves off the blood cells within the heart or blood vessels, measuring the speed and direction of blood flow, and is particularly useful in the assessment of heart valve disease. The echocardiogram will take approximately 30 to 40 minutes to complete, and once the echocardiogram is completed, you can get dressed and leave. There are no limitations as to what you can do after the scan, so you can carry on as normal. For example, you can drive. Your results will be sent to your doctor who requested the test, which may be your hospital consultant or your general practitioner. If you need help getting to your appointment, please contact your GP surgery or the hospital's transport service so they can arrange hospital transport for you. If you require further information, please contact the Cardiac Investigations Department. The contact details are on your appointment letter.